NACCHO is the collective voice of the over 2,800 local health departments in the United States. There's strength in numbers. NACCHO is particularly effective when educating members, the public, partners, and elected officials around programmatic and policy issues, and as well as funding initiatives and priorities. We know that policy is the most effective way to improve and protect the public's health, in many cases with little or no cost. NACCHO does an excellent job in keeping up with and informing local health departments about the current issues and the priorities at the federal, state, and local levels. NACCHO works with many other national partners such as CDC, ASTHO, HHS, and many others to advance public health. A very practical benefit are the annual conferences and meetings where members can get the latest public health information, but most importantly, have the opportunity to share and learn with and from our colleagues all around the country. Continue to lead the way on engaging the younger generations to interest them in being a part of the public health workforce, or even becoming an elected official that is informed and supportive of community health. Continue to emphasize educational and awareness opportunities to speak to what is public health and why it's important to every person. In other words, to build a support base for public health. Being at the forefront of thinking about AI and how it can be utilized to improve workforce efficiency in local health departments, as well as use in the educational platforms for workers, students, community partners, elected officials, as well as the general public. Continue to assist local health departments in their efforts to form strong relationships and collaboratives with their communities, to help lead efforts to bring divided communities together, even those with which we disagree, to heal the hurtful divisions in our country. This can best be done at the local level, and local health departments are best equipped to convene and facilitate this healing process. This will have an important benefit of rebuilding trust in governments, building strong relationships, and better prepare public health for the next pandemic. I was privileged to be on the NACCHO board for 10 years and served during a 4-year officer rotation, culminating in president of NACCHO. I served as the chair of several committees and was the inaugural chair of the NACCHO Past President's Council. We had several accomplishments. All were brought about by a team effort with the 3 executive directors I served with, who were Tom Milne, Pat Libby, and Bobby Pestron, as well as excellent NACCHO staff and board members and others. After 9/11, we had the opportunity to testify before Congress representing public health. This was the first time that public health was considered a first responder, along with police, fire, emergency medical, and others. Congress appropriated funds to rebuild the public health infrastructure and to begin the public health and medical emergency preparedness programs around the country. We were involved in and advocated for local health department accreditation. As far as I'm aware, we began the first regular monthly in-person meetings between leadership of CDC, NACCHO, and ASTHO. We discussed and supported the establishment of the Public Health Prevention Fund. We supported language in the preparedness funding bill that provided for a percentage of those funds be earmarked for local health departments. Lastly, we had the opportunity to travel across the country to local health departments, both large and small. I am public health, where every person is important, where we convene and bring people together around important public health issues, where we protect health, where we prevent disease, and where we promote good health for all by working together.